Welcome to another episode of the InVisible InCourage SHOW by the Invisible Disabilities Association. I'm Wayne Cannell, your host for today, and the founder and CEO of IDA. Make sure you check out all of our podcasts, including the InVisible InCourage SHOW at ida.fm and ida.tv. Joining us today is Justin Monger. Welcome, Justin.
Hey, thanks for having me on, Wayne.
Oh, yeah, my pleasure. So Justin is the founder and CEO of MedSure Systems, a company pioneering innovation medication management services. Prior to MedSure, Justin served with Hughes Aircraft at Raytheon for over 3 decades, holding senior positions in national defense engineering, business development, and executive management. He holds an undergraduate degree in electrical engineering from UCLA and a master's degree in electrical engineering from USC. MedSure Systems aims to improve patient outcomes and reduce healthcare costs by addressing medication and non-adherence, a critical issue impacting millions of Americans, costing billions annually. Justin, as the founder of MedSure Systems, what personally led you to tackle medicine management?
You know, that's a great question. To go from aerospace and defense into healthcare was certainly a radical change. But really, for me, it's personal. When I grew up, I had an older sister, a sibling, that suffered from addiction issues her entire adult life, and that led to some mental health issues. And I saw what it did to her. It led to an early demise. I saw what it did to the family and the tensions it created. And when I retired, I really looked back on that problem and I thought to myself, you know, it doesn't take the next iPhone invention to solve or at least make a huge dent in this problem. And so I looked at that, got together with a group of like-minded individuals, all of which have that same mission in mind. Let's see what we can do to really address some of these problems, whether it's making sure you take the right meds at the right time or making sure you don't take certain meds at the wrong time. We're all dedicated to that. That's what really gets me out of bed every morning and gets me going and fired up about going to work. So it really is a mission-driven company.
Well, that's fantastic. So, well, let's really dive a little bit more into this. What is medicine management, and how does MedSure Systems embody this? You know, because just tell us about that. We really need to know. I mean, it's some big technical thing, right? Medicine management. Well, yeah, we all got to manage medicine, right? What does that mean?
Exactly. Well, there's multiple aspects to it. It starts with making sure that all the meds have been adjudicated, okay, and reconciled so that there's no drug interactions. And then it's making sure that the patient takes the meds, the right med at the right time each day. And for chronic care management, that is absolutely essential. I mean, you miss taking a vitamin here and there or something, that's no big deal. But if you've got a heart condition, you need to take those meds every single day. You're a diabetic, you need to take those meds every single day on time. And so the managing and assisting and helping people stay on a complex med regimen is really what medicine management is all about.
Well, so tell us about that. So when, you know, how often, you know, what are statistics? What are those type of things that, you know, do people not take their medicine? You know, I'm guessing that it's fairly common. You know, I would think that part of it is you know, when you're taking medicine, I mean, sometimes you can have brain fog and those things as well. Plus, you're dealing with an illness or a disease or something along those lines. So what is that? What's the impact on people?
That's a great question, and I think most people don't realize how massive the impact is. About 70% of the people 65 and over have 2 or more chronic diseases, and that all but guarantees that you've got some sort of a relatively complex medicine regimen, whether it's injectables, orals, or hard pills. And you need to stay on that in order to stay healthy and manage that chronic disease. But the bottom line is about 50% of the time in this country, people don't take the right meds at the right time or don't take them at all. And the impact of that is actually massive. Very, very few people realize it, but it's extremely well documented. It's on the order of about 345 billion, yes, that's billion with a B, every single year of what is generally considered completely avoidable hospitalization and recovery costs, all as a direct result of people not taking their meds on time at the right time. It really is a massive problem. And that's just the monetary toll. There's somewhere between 120 to 150,000 deaths every single year, premature deaths that just absolutely are unnecessary. Then there's a third factor. There's doctors and hospital groups that if a patient is discharged and goes back into the hospital within 30 days, they get fined somewhere to the tune of about $25 to $35 billion a year. And there's three major causes of going back into the hospital within 30 days. And one of the big ones is medicine management or not taking their meds at the right time. So there's more than enough significant reasons to tackle this problem. You can imagine, what can we do with $345 billion every year? A lot of really good things, rather than spend it on hospital costs, emergency room costs, and recovery costs.
Well, yeah. I mean, you think about, I mean, how many different medicines do people have to take that are, sometimes it's, you mentioned somebody maybe with diabetes or something where it's all, it could be a lifetime, right? It could be a lifetime of medicine. And so it's a constant having to take care of that versus somebody maybe on like a chemo medicine where it's very specific. You got to take so many doses, right?
Exactly. So managing somebody's medication, whether it's an oncology patient, whether it's somebody trying to manage a chronic disease or multiple chronic diseases, it all still comes down to the same thing. What do you need to do to change and impact the behavior of the individual so that they take those meds every single day at the right time? And that's really the big challenge. Seems simple, doesn't it? But it really is a big challenge, Wayne.
Well, I've seen those. What are those little pill things you can get down at the drugstore, right?
The little $2.99 Sunday through Saturday. Yes. And they're
so what is the problem?
Well, every 2 weeks, somebody's got to go fill that thing up. It's a pain in the neck. I mean, I used to do it before I got into the program, and I would forget. I would miss it. Every Sunday, I got to sit down and fill it, open up all the vials and fill it. It's a pain in the neck. And I think the real evidence, Wayne, is the fact that those things right here, one of these, here it is right here, these have been around for 30, 40 or more years, and they haven't solved the problem. They have not been effective. I'm sure they help a little bit, but they haven't solved the problem. And so otherwise that $345 billion a year wouldn't be what it is. So we're out to try and fix that using technology, be able to use it at scale with the millions of people that need the help. And let's see if we can't take a huge dent out of that $345 billion.
Well, so speaking of MedSure Systems, so I mean, what is your approach? I mean, obviously, like I said, you're not using the little plastic Sunday through Saturday thing. So using technology with your background in engineering and those things, I mean, what sparked the idea and what is the thing that you said, oh my goodness, there's got to be a better way to do this, especially with technology.
It's a great question. And like so many significant disrupting technologies that come in, it's on the surface, very, very simple, very, very straightforward. Behind, there's a lot of complicated things going on, but out on the surface, what the patient sees, it's very, very simple. And so what we do that's unique is we do a combination of what you would call a digital intervention. That could be a beep, a text, a timer, or something that reminds the patient to take their meds, in combination with what we call relational care or human intervention. It's the two of those together that really get the absolute best possible result in terms of getting somebody's med adherence score or med compliance rating well above 50%. We've achieved well over 95% across the board. And it's that combination of human and digital intervention. And it's really that straightforward.
Well, I think about, how often people, they have, they have a prescription for 30 days. They can't run out, but they get to the end. They're not paying attention. They, oh my goodness, did I take it? Did I not take it? Do I need extra? And the problem is that, trying to get refills even, right? If you don't manage your medicine right, sometimes you can't even get a refill correct.
Exactly. When you hit the nail on the head, almost 80% of the people, the explanation or the reasons for people missing a med, there's two reasons that make up 80%. One of them is, oh, I forgot. Okay. The other one is they ran out. They didn't get the refill done. And that is one of the key things we do. We actually network the pharmacy, the doctor, the patient, and the caregiver all together. and we track the refills, and we make sure the patient does not run out. If they have to go do a doctor visit before they can get the next refill, we make sure that gets set up and that happens. Also, that the patient has the pills they need every single day and suddenly doesn't realize on the first of the month, oh my gosh, I've got to go get my refill. And they go 10 days without their meds. And that's a classic problem.
Yeah, that sounds like a really a big problem, right? Because what happens? They end up in the emergency room, I'm guessing, right?
Exactly. And that's what contributes so much to those. Well, they either end up in the emergency room and drives a huge part of that cost, or God help, they pass away, or they have a major incident and they wind up in assisted living for the last 2 years of their life. And it's not a good outcome, no matter which way it goes. And so to try and tackle this problem, Medicare has seen it, the government has sees it coming, and they're putting some serious effort at trying to solve the problem. And we're right there hand in hand with the government doing that.
Yeah, I was going to ask you about that. How you guys are interacting collaborative with Medicare, Medicaid, those things.
Yeah, great question. About 3 years ago, a little more than 3 years ago, we had been campaigning the Center for Medicare and Medicaid Services to pay for and reimburse for some version of medicine management service. And we'd been doing that for about 2 years. And then they came out, surprised us all, and they said, yes, we're going to start reimbursing for it. And it was a watershed moment. It was a watershed moment. It was absolutely amazing. And so our partnering with them, because we had, along with several other companies, I'm sure, had been in to talk to CMS about this and how you should potentially do it. Model it after what's done for remote patient monitoring. Call it remote therapeutic monitoring, or RTM for med adherence. And that's exactly what the government has done. They see the problem. They see the bow wave of costs coming down the road, with over 10,000 people a day turning 65, and 70% of those people have a complex regimen. That's a growing problem, and it's not getting any better.
Right. Wow. So how do you guys engage with the pharmacists? You know, obviously you've got to get these different meds, and I'm sure some of them are controlled, some of them are not. You know, how do you kind of work that to make sure that that the patients are adhering to it? That, you know, what kind of results are you seeing? Are there any unique strategies you guys are doing?
That's a great point. There's a couple answers to that. So let me take a minute or two. First of all, we are really, really strong on what we call the home pharmacy rule. We had some patients that came into the program that had 5 docs and 5 different pharmacies, and none of those docs knew about the other docs, what they were prescribing, and none of the pharmacies knew about each other. And so these patients were taking double dosing on stuff because they didn't know about each other. So the one pharmacy rule is extremely important. And what that is, or the home pharmacy rule is probably a better way to put it, is all your meds, all your prescriptions go through one pharmacy. And that way the pharmacist can do what they do best. They lay out the entire medicine regimen that you've got, and they look for drug interactions and any issues that may occur, and tell you need to take this one in the morning and then take this one in the evening, and they lay all that out. And then working with the pharmacists like that, allowing them to do what they do, is absolutely critical and step number one. The second thing we do is our partner pharmacies take all of their meds and put them into strip packs, basically pouches. I've got an example right here. Okay, and there's a fair number of vendors out there and pharmacists out there that do this, so that every pill you take in the morning, say, may be in the first pouch, everything you take at bedtime might be in the second pouch, and then it just repeats itself on a roll. And our partner pharmacies ship those directly to the patient every single month, so they don't have to go to the pharmacy to pick up their refills. They're delivered right to their home every single month. And that is another key point in the service. If the patient can't get out and get to the pharmacy to pick up their meds, that becomes a problem as well.
Well, I think about that. You know, you think about what you see in like maybe an assisted living or a rehab or some, you know, there's like 500 little cups of stuff, right? Having exactly. These little packages seem like, oh my goodness, you know, how amazing is that for somebody who has to support multiple people, right?
Oh, I can't tell you enough. We have some testimonials from some caregivers who are taking care of an older parent, and they complain constantly. They come over to their parents' house, and they look under the table, the kitchen table, and there are pills all over the floor. And what does that mean? That means they didn't take those meds. Okay, so the real making it as simple and as easy as possible is really key to the whole thing. And in our first year, in June of 2023, we did a 1-year evaluation with a large endocrinology practice here in North Dallas. And over the course, they gave us a bunch of patients that they believe were compliance problem patients. They weren't taking their meds regularly. And over the course of a year, we got 99% med adherence out of all those patients month over month. That convinced her, the owner of that practice, to go forward with it. And then of course, you talk to the patient. How are you feeling? Are you feeling better? Their numbers got better. Their A1Cs got better. And the patients are feeling better. So it's all the way around this combination of digital and human intervention, networking the pharmacist with the home pharmacy policy, with the doctor, with the patient, with the caregiver, has proven to be extremely effective.
So how does we have a lot of people obviously too that with invisible disabilities that like you said, live in chronic illnesses and those things. I'm sure there's some supplements too that maybe do they just get that through the pharmacist as well, so that it kind of that rolls into that regimen as well on certain things, so that they can add it to their packets, or how does that work?
That's a great point. Yes, our partner pharmacies can put supplements, vitamins, and all the rest of that into the pouch. In my case, I take 3 or 4 prescription meds a day, but I take another 5 or 6 vitamins, and they're all in my pouches, and they do that. Now, you asked the question earlier. I think I might not have answered it. In the case of controlled substances, one of our partner pharmacies can actually ship just about every kind of controlled substance, including opioids, can ship them in strip packs and mail throughout the United States. That's pretty rare. So we've been pretty selective about picking our partner pharmacies. But one of our pharmacies has the ability to do that. So,
yeah, I would think that having it in a packet is a good help in that area as well.
Yeah, and it's complicated. Shipping opioids, controlled substances, that is, I don't even want to know what the paperwork is to have to do that, but you can bet it's a stack.
Well, so do you find that, who do you find that's really more focused on the medicine management? A lot of times you find that it's a caregiver that's doing it, or is it the individual, or kind of a mix?
A great question. For the caregivers, it's a very, very simple choice. When we first talk to the caregivers about it, we show them the pouches, we show them the system we have. They're like, I'll take it. I don't think we've ever had a caregiver say, no. I'd rather fill this up every single week. No, nobody has ever said that. That's for sure. So the caregivers absolutely love it. And through the app that we have, the caregivers, if they can't get over to the house every day, through the app, they know whether their loved one has taken their meds or not. So it's just been an absolute godsend for caregivers. And there are a large number of unpaid caregivers, and they are stressed because most of them have families of their own. And it's just an extremely stressful thing to do. So anything we can do to take the load off of a caregiver is to me the right thing to do.
Well, I'm thinking about what you kind of just brought up there. I'm thinking about the physicians. I mean, I would think a physician, that would be something great to know. And so how does the technology kind of either currently or as you see it in the future, connecting with the physicians so that they can see that too, right? As a professional caregiver.
Exactly. So we have a direct interface down to the practice. They have a portal they log into. They can see the compliance for any patient in near real time. And typically what they'll do is when a patient is coming in for, say, a 3 or 6 month checkup, they'll have the medical assistant pull up the compliance record for the last 6 or 9 months or whatever the case may be. So the doctor has it for the actual sit down with the patient. And that is really, really important, because if the patient is having some issues, something not going well, the blood pressure is, say, moving up into some potentially dangerous level, the doctor can look at that, and the doctor doesn't have to guess. Is it because they're not taking their blood pressure meds, or is it because something else has changed? And we rule out one more thing that the doctor has to guess about before they try and remedy that problem and control the chronic disease.
So through all the all the people that you've been working with, do you have a specific instance where it was pretty dramatic, the change, because of the change in the fact that there's a regimen involved, there's like you said, there's a personal touch, there's a technological touch.
Yep, exactly. I think some of the most convincing, the ones that honestly, it sound corny, but it brought a tear to my eye. We have a caregiver here, one of many caregivers in our program, with her father, and she did a testimonial for us. And she just absolutely ranted and raved about how her dad is doing so much better because he's getting our service. She loves working with the human intervention side of it, the personal MedSure coordinator. This is basically a care coordinator that is focused on med adherence. She works with them on a regular basis, and she just loved it and loves her father's doing so much better now as a result. It's just amazing. In fact, we have the customer testimonial on our website. Anybody wants to take a look at it, can go look it up. It really is, I hate to say, a tearjerker, but it's just, you know what? It's the reason I'm doing this job. It's the reason we're doing it.
My name is Joaquina Robinson. My father is John Williams. He's 86 years old. One, we know that he's taking his medications and that he's taking his medications on time and that he's not missing doses because he was missing doses previously or losing pills. And these little pre-filled packaging, and you know exactly what you're taking and when you're taking it. And they deliver to your house. Like, that's the best thing. You don't have to go dealing with a pharmacy. It's perfect. Ava is wonderful. I mean, if you miss the dose or you're trying to have questions about any specific things, if you just reach out to her, she's immediate to respond. I mean, she's excellent as far as giving you the knowledge that you need, how to use the program, any resources that you may need. She's an excellent source. But it's helped me a lot because I was struggling, keeping his medicines organized. Did he take pills? Did he miss pills? And basically, it's helped a lot as far as, I know he's taking his blood pressure medicine, or I know he's taking his blood thinner medicine. So basically, it's helped a lot to keep up with what he's taking, when he's taking it, how he's taking it. Before we started MedSure program, as I mentioned, my dad, he's 86 years old, and we started when he was, of course, 85. Before that program, I would go over to the house and I would have to sit down and take all of his pills out of his pill bottle, pour them in little containers, one by one. Half of the time I would come over there, pills are on the floor. I'm asking him, did you take the pills? No. So being that we've gotten connected with MedSure, it has been a lifesaver.
Well, absolutely. I mean, the whole point of a doctor recommending a specific medicine is they're hoping that it will help in whatever the issue is, right? I mean, that's a big part of it, right? And
absolutely,
I do know that there are people that where maybe medication is not their favorite thing in some instances, but there's other instances where it's highly critical, right? So, one of the things you're not trying to do is you're trying to say, hey, we're trying to help people with whatever the doctors are doing to make a difference in people's lives by saying, hey, if you need to take 10 of these, I mean, you think about it, you hear about it, somebody gets sick, they say you got to take 10 days of antibiotics, and people like, I don't need all 10 days. And then they're sick for months, right? Because it's
exactly.
Like, well, maybe you should have taken it all.
Yeah. Well, and that raises the point, Wayne, of the personalization. This is not a one size fits all solution for everybody. There are, if you take the group of patients that really need help with their compliance, Some of them need a fair amount of hand holding and prefer that and like that. We have other patients that we, some of our PMCs lovingly call them Grandpa Grouchy Pants. They don't like to be bothered unless there really is a problem. You don't bother them unless they have something really, they've missed a med or they got to do something about their refill. So you've got to be able to customize for everybody. There are some people that have no problem with a notification coming across their smartphone. There are others that find it incredibly irritating. So when we set them up, we customize the entire program based on what makes them comfortable, what's going to be the most effective thing for them to do. And that's not something a lot of the other guys are doing. And an all electronic or digital intervention program can't do that either. So it's really important to customize it for each individual.
Well, thinking about that, maybe there's some aspiring innovators that, that are out there thinking, hey, I really want to improve healthcare and stuff. And, kind of speaking about what you just talked about. So what's like an important lesson you did learn in this process as you've been developing this whole, the technology? You got some really cool technologies. But what is that thing you said, aha, it's not just about this, it's also about this?
It's because we're trying to change human behavior and get them, the individual, to take their meds. You have to look at the whole picture. And so when you look at the whole picture, you look at all the stakeholders. You got the pharmacy, the doctor, the patient, the caregiver. You could just go after one of those 4 components or 5 components if you take the big pharma into account here, or the payer. And you can't do that. You got to look at the whole big picture. So key advice that I would give to anybody who wants to get into this is look at all the stakeholders and talk to all of them. Make sure that they have a say in what makes this either easy or hard for them. What are their pain points? We talked and we spent a lot of time surveying doctors, pharmacies, hundreds of patients, as well as dozens of caregivers. And then you put together a solution. Now it makes it complicated. You got all these different stakeholders and they all got different things. Sometimes they appear to be conflicting, but you're going to get the best possible product and the most effective product out the door when you take all of the stakeholders into account. And that really is, and I don't care whether you're designing a medicine management service or, the next widget to go on your phone, who does it impact? And does everybody that it impacts have a say and an understanding and agree that, yeah, this is a great way to do it? And that's really the bottom line there.
I think you found that my understanding is that personal touch, you talked about that personal touch, right? I mean, it's not like it's such a big issue that people, as you were talking earlier about the dollars involved and the percentage of people that don't take their medicine on a regular basis, those things. It's not so simple as just going down to your local department store and buying, like we talked about earlier, the Sunday through Saturday type of deal. There has to be, as you talked about, kind of a personal touch intervention as well.
Yeah, exactly right. And right now, in order for Medicare or Medicare Advantage to reimburse for it, your doctor needs to order it. The doctor needs to see that this is something you need. And the Medicare billing has to be done through the doctor. So it is the doctor's a key player in here. You without the doctor, this isn't going to happen. The next component is you got to have the patient that's willing to do it. And not all patients want to do it. But if you can make it flexible enough and easy enough for all those patients, then you're going to win the battle. You're going to win. So all the way around, no matter what you do, there's some people that just want to go off on their own and do it. But there's about 15 to 20%, which about 6 to 8 million people in this country that have a difficult time managing their meds. And that's a lot of people. That's a lot of people. And so we're out there to get to as many of those as we can. And that's our goal.
No, that's fantastic. So, this is the InVisible InCourage show. And that's encourage, that's I encourage, right? Because people need courage to make it through the day. And so I was just, we'll always like to ask our guests, what a moment or a time in your life when you needed courage just to make it through the day, and what gave you that courage?
I know, Wayne, I'm really glad you asked that. there's two things in my life that have done that for me. Number one is my family, my wife, and my children, and the support they've given me. Because going off on this adventure, anytime you start a company, I don't care whether you're starting up a candy company or a medical device company, you are going to put in incredibly long hours. It's incredibly stressful. You're going to have time away from the family. And almost no matter what you do, your family's going to be impacted. And my family has been so supportive. My wife in particular, here I am, I'm retirement age and I'm still putting in close to 60 hours a week. That isn't what my wife envisioned, but you know what? She's right beside me the whole way, supporting me the whole way. And my children, they've never asked me, Dad, why are you doing this? They don't ask that. They know why we're doing it. Okay. And when I say we are, it's really the whole family doing it. The second thing, of course, is my faith. Church is extremely important to me. And when those tough days come along that you just want to quit, there's nothing like falling back on faith and hope to get you through the day. So between my family and my faith, I feel like Superman. I've got the invisible shield up, and I'm going to make it with those two on my side.
Well, fantastic, Justin. It is, we need courage each day. We can think about the long term, but really it's each day. So many people with invisible disabilities, it is making through that day. Their Mount Everest is, going from here to there to just to make it, to get up, to make lunch, everything like that. So that's their journey. It's a journey that you need courage when things are going tough. And I really appreciate what MedSure is doing. MedSure, you guys received our innovation award a few years ago, and the reason why is we're always looking for innovative technologies that are making a difference in people's lives. Our goal is to change the way the world sees disabilities, right? And to look at them. And what I love the fact is when technology can make people feel that they're important. And that they're not lost or abandoned, which we see that a lot of times with invisible disabilities. And the fact you're saying, you know what, hey, if we can help make their lives better in this area, make it simpler, I think about people with dementia and all those things. What an amazing boost this is for the caregivers and for those people themselves who are able to manage their medicine. But to give them this extra little tool, extra little bit of technology to say, hey, they matter. Right. And what they're, I love the fact that you work kind of as a group with the doctors and the pharmacists and the care managers and all those things to say, yeah, let's make this an important thing in somebody's life. So I really appreciate that.
Thank you very much, Wayne. And we've enjoyed so much supporting your organization over the years. You were the first philanthropy that we signed up for. And we're going to be teamed together for a long time. Thank you very much for the opportunity.
Well, it's and we appreciate that too as well. And the Invisible InCourage show is really about showing that invisible InCourage, right? Because we all do need visible courage, as I like to say, to make it through the day. And so remember, in those tough times, that you're not alone. Because that's a big part of what we talk about, and that people with invisible disabilities, you're not only not alone, we believe you, we care about you, we want to hear what you're going through, and let you know that we're here for you. So one of the things we want to say is to make sure you join us online at IDA.fm. That's our podcast. IDA.tv. That's our videos on. Out there, you can watch a bunch of our videos, which are a lot of those are the podcasts as well as more. Check us out at invisible-disabilities.org. And as a reminder, IDA, we are changing the way the world sees disabilities. So thank you so much, Justin, for being a part of this Invisible InCourage show today.
Thank you for having me on, Wayne. You have a beautiful day.